Hello friends, today we'll discuss about the difference between diagnostic and screening mammogram exam, since many coders still have confusion in coding diagnostic and screening exam for mammogram. So let us check why these two exams are done. So first we'll see the screening exam. Screening exam is a precautionary measure and should be very help to find the early detection of the disease. Also, in for example, in USA, the breast cancer is very common among women and is very dangerous, and hence a periodic screening exam is performed by women to have a precautionary measure and detect the abnormal cancer cells in the early stage only. So this is just a screening mammogram exam just to see the early symptoms of breast cancer, because it is very common in country like USA, and this can happen in other countries as well, but just a precautionary measure they are taking the screening exam on a periodic basis just to find the early detection of this dangerous disease called cancer, breast cancer. So screening exam is performed on patients who are asymptomatic. Asymptomatic means without symptoms. So this exam is basically done on every patient after a certain age, on women with who are having no symptoms. So this is just a screening exam to find out if the patient is having any symptoms or any early signs of breast cancer. So this is very important to find the early stage of the cancer. While diagnostic exam is performed on a symptomatic patient to diagnose the underlying cause of a sign or symptom. So if suppose a patient is having any symptoms, so no need to go for a screening exam. You can directly go for a diagnostic exam to find the exact diagnosis or the sign of symptoms it is having, and the basis of sign and symptoms you can go ahead and for the treatment for the early detection of cancer. So this will be helpful to treat the breast neoplasm or cancer in early stage. Now let us check out what are the CPT codes used for coding diagnostic and screening mammogram. So in mammogram, if the patient comes with a sign and symptoms like breast mass or lump, it should be reported for diagnostic mammogram with CPT code 7765065 77066. So 77065 is for unilateral and 77066 is for bilateral. So that is only difference between them, but both are used for diagnostic mammogram. While for screening mammogram, the code should be reported with CPT code 77067. So these are the three codes. Two codes are used for diagnostic mammogram, and one code 77067 is used for screening mammogram. Now for screening mammogram, main thing to remember is there is a particular Z code called Z1213 Z12.31, which is encounter for screening mammogram for malignant neoplasm of breast is reported as primary diagnosis code. So to fulfill the medical necessity or to support the CPT code, we have to code the supporting diagnosis, which is for screening mammogram Z1231. For some, like for Medicare and all, like payers, we have to code this code as primary, because if they don't find this code with CPT code 77067, they will deny the claim. They will not pay for the real money, because if the CPT is not supporting the diagnosis, or the diagnosis is not supporting the CPT procedure code, then it will automatically get denied in billing. So you have to check the ICD also and the CPT also, whether both are supporting each other or not. So this is the main difference between diagnostic and screening mammogram. Please do remember all these things while coding this procedure in future. If you like the video, do share it, and please subscribe to my channel so that I can share all these medical coding tips in future as well. Thank you for watching it. Thank you again.